Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with Fertility and Pregnancy T and U. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions. Then I'll move on to ailments of the brain and nervous system. Then I'll address issues with your skin, nails, and hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, and pancreas, kidney, bladder, then ailments specific to women and then specific to men, then issues of the hormones and metabolism, then remedies for infections, infestations in the immune system, then issues surrounding fertility, pregnancy, childbirth, postnatal problems, and special problems in infants, ailments and diseases in childhood, and special issues of adolescence, and finally special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it's recognized that people react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, nature muir people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, gangly, and of a stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses and diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with fertility and pregnancy, T and U. Every month during a woman's reproductive years, a ripe egg is released from her ovary and enters the fallopian tube, and the mucus at the entrance of the womb at this time becomes less sticky. If intercourse takes place, millions of vigorously swimming sperm make their way through the mucus into the womb and into the fallopian tubes, where they congregate around the egg, causing it to spin around with the movement of their beating tails. Eventually, one sperm penetrates the egg and the nuclei of sperm and egg fuse, and the process of cell division begins. The fused nuclei split into 2 cells, then 4, then 8, then 16, all containing the 46 chromosomes that will create a new and totally unique human being. 7 days after fertilization, this ball of cells embeds itself in the wall of the uterus. At 20 days, the placenta begins to form. At 30 days, the spinal cord. At 6 weeks, the heart. And by 13 weeks, all the body organs are formed. At 5 months, the baby can be felt to move. At 6 months, the lungs become functional and the nostrils open. At 7 months, the baby should be in the head-down position, ready for birth. A full-term pregnancy usually lasts 38 weeks, counting from the moment of conception to the time the baby is born. Conception usually takes place halfway between periods if the woman's cycle is 28 days and regular. However, since many women's periods are not exactly 28 days, pregnancy is usually measured as being 40 weeks from the first day of the last period. Common pointers to pregnancy are missing a period, more than usual tender or swollen breasts and darker nipples, nausea, tiredness, a frequent urge to pass urine, and sometimes loss of appetite, or cravings for unusual foods. To confirm the pregnancy, the woman should have a pregnancy test. The chances of having twins are about 1 in 80. Identical twins develop from the same egg and share the same placenta. Non-identical twins develop from different eggs and have a placenta each. Only 3 pairs of twins in every 10 are identical. Triplets are much rarer, only occurring in 1 in every 6,400 pregnancies. Once it is determined that the woman is pregnant, it is important for her to go for regular prenatal checkups. Prenatal care is important since it allows you to find out at an early stage if there are any problems. An ultrasound, which is a sound picture of the baby in the womb, is thought to be harmless to mother and baby, and can be used to monitor the size, shape, and position of the baby at any stage of pregnancy. Amniocentesis, which is the taking of a sample of the amniotic fluid around the baby, is usually carried out between 16 and 18 weeks, but only if there is a previous baby has been abnormal, or if there's a family history of congenital problems, or if the mother is over 35. Here in brief are some of the do's and don'ts of pregnancy. Treat your baby as a person from the word go. Moderate exercise, such as swimming and walking in the fresh air, are very good, but anything that involves repetitive compression of the spine, such as horseback riding or trampolining, should be avoided. Always keep 25% of the energy in reserve. Do go to prenatal classes. They will teach you what to expect and how to breathe in order to cope with pain during labor. Don't wear tight clothes and get as much sleep as you can and avoid late nights. Also, don't sit in hot baths for too long. 10 minutes is about the maximum, especially if you faint easily or have a tendency to bleed. Avoid serious travel if you can, especially if you've had a threatened miscarriage or there are complications or you suffer from travel sickness. Most airlines do not like you to fly after 32 weeks or so, so if you must fly, check with the airline first and stop working before 28 weeks if your work is very strenuous. The expectant mother needs to eat a healthy, well-balanced diet with an increase in iron and calcium foods, and also a modest increase in protein intake, preferably in the form of oily fish, nuts, seeds, pulses, and whole grains, with generous helpings of raw vegetables and fruit, will help to guard against constipation. Tea, coffee, and alcohol should be avoided, as well as chamomile tea, especially in the latter stages of pregnancy. Homeopathic remedies during pregnancy. During the first 3 months of pregnancy, the most vulnerable time, you should avoid all medication if you possibly can. That means prescription drugs, recreational drugs, over-the-counter preparations from drugstores, and health food shops. There is no evidence that homeopathic remedies cause any problems during pregnancy. But to be on the safe side, they should not be taken in potencies less than 6C, except for tissue salts. It is probably best to avoid low-potency apis altogether and take 30C if you need to. For minor complaints during pregnancy, homeopathic remedies should be tried first. If you feel very unwell, then see your doctor before taking anything else. Termination of pregnancy. If pregnancy is unwanted and bringing up a child yourself is totally unfeasible, you have 2 choices, termination or adoption. Termination pregnancy involves a D&C, that's a dilation and curettage, or suction removal of the contents of the womb. This is a 15-minute procedure done under general anesthetic and seldom involves a hospital stay of more than 12 hours. Specific remedies to be taken 4 hours for up to 3 days after the operation. Feeling upset with lump in throat and tight feeling around chest. Use Ignatia 30C. Where symptoms are more physical, with abdominal pain and cystitis, use Staphisagria 30C. Urinary problems during pregnancy. Urinary problems during pregnancy are usually caused by pressure on the bladder, urethra, and pelvic floor muscles, and can be aggravated by tight jeans, non-cotton underwear, bubble baths, and things of this nature. Cystitis causes a burning sensation upon urination and a frequent urge to urinate. If none of the remedies that follow seem appropriate, more remedies and self-help measures are in my video on cystitis. Specific remedies to be taken every 2 hours for up to 3 days. At first sign of discomfort, especially if weather is cold and windy and you are feverish, restless, and apprehensive, use Aconite 30C. A slightest tension causes leakage of urine, scalding sensation during and after urination, lack of thirst, heat, and lying down make discomfort worse. Use Pulsatilla 6C. Bladder and urethra feel itchy and irritable, dribbles of urine passed frequently and with some difficulty. Use Nux 6C. Urge to pass urine most frequent at night, burning and soreness after passing urine. Urgency, urine copious and almost colorless. Use Sulphur 6C. Passing copious amounts of cloudy urine at frequent intervals. Burning sensation, urge to pass urine most frequent at night. Use Phosphoric Acid 6C. A bad attack of cystitis with constant burning and urgency. Use Cantharis 30C. Incontinence of urine. Incontinence of urine during pregnancy is due to the extra strain on the muscles that close the sphincter of the bladder. See my video on incontinence of urine and stress incontinence for more information. Specific remedies to be taken 4 times daily for up to 14 days. Remedy of first resort, Pulsatilla 6C. Bearing down sensation as if contents of the womb are about to fall out of the vagina. Use Sepia 6C. Incontinence made worse by coughing. Use Causticum 6C. Retention of urine. Retention of urine is not uncommon in latter pregnancy and tends to come on gradually. The urine flow becomes scantier and intermittent pain in the bladder area. Scanty flow can also contribute to cystitis. If the pain becomes severe and urination becomes impossible, see a doctor within 2 hours. Your doctor will pass a small tube called a catheter into the bladder to drain off the urine. The remedies that follow are only suitable in the early stage of retention when urination starts to become difficult. Specific remedies to be taken every half hour for up to 10 doses. Remedy of first resort, Nux 30C. If Nux does not bring relief, then use Pulsatilla 30C. I have a great many videos now on many different topics, so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.